Hi, so today is May 19th, and I want to give you a brief update on COVID-19. I'm trying not to do very many of these updates, but lately there's been some fairly valuable information coming out that I wanted to share with you. Before I get into things that we can do, I wanted to talk about testing for a second. The PCR testing that looks for the virus actually in you has been shown to be somewhat unreliable. And there's some too much room for human error in the way that it's being processed. But it definitely is weak on the false negative side. That is, if it comes back negative, that doesn't mean you don't have it. It's not doing a very good job that way. And then the antibody testing is kind of the opposite. That is, if you show that you're negative to the antibody test, there's a pretty good bet that you have not come across this virus yet, and you should continue to take good precautions. So I won't go into social distancing and so forth. The places in the country are opening up at different rates, and people are going to have to make their own decisions regarding kids, school, work, etc. But there are some things that are important to keep in mind. And I do think that this virus is not going anywhere. It's, as I said earlier in other videos, this thing is here to stay. I also see no reason for there to hope for any type of seasonal or climactic influence on the virus. It's raging in Brazil, Ecuador, and it's doing just fine in Sweden as well. So until I see evidence that way, I'm not going to think that the summer it's going to just kind of go away. I think it's pretty much here to stay. So let's be smart and let's be healthy. As far as being healthy goes, one of the things that's been really important that's come out is hemoglobin A1C. So hemoglobin A1C is a measurement of blood sugar levels over the past 3 months, and a study in China came out showing very clearly that those who were infected with COVID-19 who had elevated hemoglobin A1C did much worse. That is, their inflammatory markers got worse, their coagulation was worse, and their O2 saturation, their oxygen saturation, was much worse than those who had hemoglobin A1C that was lower, around the 5.2 area. So that has to do with blood sugar levels and diabetes, and you've heard that is a risk factor. But what's important to note is that in 10 days or less, you can make a difference in all these metabolic factors regarding glucose metabolism. So exercise, sugar intake, carbohydrate intake. I talked about intermittent fasting in a previous video. I think those are all really important factors, and it doesn't take very long before you can switch your metabolism into a healthier state. So try to do that. Other research that came out is regarding vitamin D, which I've also spoken about before, but there was a meta-analysis done by Trinity College in Dublin showing that when vitamin D was insufficient, people's mortality seemed to be much worse, or that is, be a higher risk of mortality. So not severity of symptoms, actual mortality. So take your vitamin D, get some sunshine, exercise outside, right? The other one that I want to touch base on is NAC, N-acetylcysteine. It's important for two reasons. One is it's a building block for glutathione, and glutathione has to do with oxidative stress. So when we are under oxidative stress, we use glutathione to get us to a more neutral state. People who are under oxidative stress do much worse with COVID-19. Oxidative stress is caused by junk food diet, obesity, lack of exercise, high blood sugar. Blood pressure can play a factor in that. So you want to get your glutathione up there by not doing those lifestyle activities and getting your NAC. The other way that NAC is helpful is it helps break the disulfide bonds of mucus, so that when you do get the congestion that can come with a COVID infection, it's easier to deal with. So as I've mentioned in other videos, I have the doses you want to get on your NAC. And then lastly, I want to touch base on fish oils. I think those are really important to stay on for many reasons, but especially with COVID-19, because it really is clear now that it is a vasculitis. It is a virus that causes inflammation of the arteries. It is affecting the endothelial cells, which are the cells that line the arteries, and when they get basically destroyed by the virus, they release all the clotting factors, and that's why we're getting these various clotting symptoms in people, whether they're young or they're old. The omega-3 fats are very nourishing to the endothelial cells. They help with proper function of those cells. Also, the omega-3s help reduce inflammation, and they also help reduce coagulation, which are two things you want if you're going into a prothrombic state if you're infected with the COVID-19. So I know that was pretty fast, but diet and lifestyle can make rapid changes. Vitamin D, take it with your fish oils, NAC, and then get your fish oils, high dose, high quality fish oils. Okay? Good luck, and I'll let you know when I have more information. Cheers.